Syphilis tsunami. No shot, no shield. The hidden STD crisis that no one is talking about. Let's talk about it, family. Yeah, while most of y'all been doom scrolling in your free time, there's a public health emergency creeping through our communities and no one is talking about it. But they probably should. You see it right there. Supply shortage of long-acting injectable penicillin. And just for y'all edification, I kind of talked about this already, as you can see back on, June 25th. I kind of talked about the STI wheel right there. So you can go back and look at that where I talked a more broader discussion on STIs, but today I'm focusing specifically on syphilis. In case you didn't know, Pfizer, the maker of Bicillin, has just paused the production of Bicillin, the gold standard injectable treatment for syphilis, until September of 2025. And they say this is a voluntary recall, which is likely due to some internal quality control issues that need to be addressed, coupled with an increased demand for Bicillin to treat the increased rates of syphilis out in the community. Given these new developments, the current inventory of Bicillin is likely going to be reserved for pregnant women because of what we know happens from an intrauterine standpoint when the woman is pregnant, and if she's exposed to syphilis, it can cause a lot of negative effects to her unborn child. So they're likely going to be strongly encouraged to reserve treatment with the Bicillin that they currently have in inventory for that specific population until we see how this development plays out long term. Now let me break this down to you. Syphilis is a preventable and treatable STD, but unfortunately, it is rising fast in communities of Black, brown, and underserved populations in this nation. And the sad piece of this is the one-shot treatment that we all depend on, that Bicillin, it may be temporarily unavailable for an undisclosed period of time. Now they're saying September 2025, but who knows how long that's going to last. Now, Bicillin, also known as Penicillin G, benzathine or benzathine penicillin G, it has been critical for the use in people with limited access for treatment that have been exposed to syphilis, especially in pregnant, vulnerable women, as I've already mentioned, who need fast treatment to prevent complications that could happen to their developing fetus. Now, without this being readily available, as they've already predicted, we have to act quickly and educate boldly so we can stay ahead of this curve. And the CDC has already reported a spike in congenital syphilis cases. That is the case when mom gets syphilis and she passes it along to her unborn child. Now, this is a moment to re-educate, empower, and protect our community. We cannot cure what we don't talk about. As you can see here, syphilis is not taking a break, so neither should our awareness. We may be one shot down with the Bicillin being temporarily unavailable, but we're going to stay up on our prevention. Because when we stay woke, we stay well. Here's the bottom line, family. Now more than ever, we need to lean into prevention and education and awareness. All right, I would encourage you to pause and take a screenshot of this, but we need to get tested regularly, protect ourselves and our partners, talk openly about STIs, use protection every time, support our community clinics and health educators, and we need to stay informed about symptoms and treatment. And there's one thing I want to point out on here that we don't always think about. See that right there? Wash your sex toys. Now let's use this moment not to panic, but to pivot. Because when we know better, we do better. And when we take care of us, guess what? We all win. Hope y'all got something out of this one. See you soon. Peace and blessings.